Hello, we are the PPI group members from the MODE study, and here's our message to you about the research we've done and the next steps we believe the research should take. In our study, we've been looking at interim diagnosis and the way in which they might delay a cancer diagnosis. So to begin, what is an interim diagnosis? An interim diagnosis is a diagnosis given before referral for a suspected cancer that temporarily explains the patient's symptoms.
Now that you know what an interim diagnosis is, you might be wondering, why does it matter? We can think of the interim diagnosis as stepping stones to the diagnosis. A GP is making sense of what is happening and can leave the door open to other diagnoses. But this may also go in the wrong direction. The stones could be leading towards a diagnosis or management approach that delays a diagnosis of cancer. This can mean patients lose trust in their clinicians and are stuck, suffering from symptoms and waiting for answers that could lead to them missing key experiences like family events. And it may even impact the outcome, for example, by shortening lifespan. It can leave patients with a huge sense of regret. There is also regret on the part of the medical team for missing things.
So what is the impact of our research? Safety netting is the process of providing patients with clear information and a clear plan what to do if their health condition doesn't improve, changes or worsens, especially when the diagnosis is uncertain. Keeping patients safe involves a number of things: having a flexibility mindset to accept and acknowledge when things are not behaving in the way that you think they should be or going as expected. Being open to learning, stopping patients from being left in the dark by letting people know why an investigation is being done, what the next step might be if things don't go as expected, and following up with patients after referral or investigations. Using digital tools could make this process easier.
And finally, what we want stakeholders to keep in mind is that interim diagnoses are not necessarily wrong based on the knowledge available at the time. The focus should be on how to move on from them when they are not working. And this is why the patient-doctor collaboration is so important. Getting communication with patients right, building patients' platform and supporting the patient voice. Communication should be right for everyone, making sure we are thinking about language barriers, learning disabilities and cultural differences. We want to move away from blame and towards solution, working together to manage health knowledge and beliefs, fear and anxiety, and deciding where we can have the most impact. This could be by how many people are affected, the impact of missed opportunities to diagnose cancer earlier, and how easy is it to make these changes. What do you think is the next step?